First, I have a question for everybody. Are we all familiar with nanoparticles? And how many people have a familiarity with oncology and nanoparticles? Okay. How many anti-cancer drugs can you name that are based on nanoparticles? So there's a reason for that, and that's what we're going to be talking about today. I'm with a company called SuperiorNano, and going back. And the problem with a lot of cancer drugs is that they're bricks. They bounce right off of people, the intestinal wall, and the skin, and they just drop to the floor. Very hard to get these large molecules into systemic circulation to treat cancer. And that's why you haven't heard of any anti-cancer drugs that are based on nanotechnology. Because they require intervention to get them in the bloodstream. So what we're confronted with is not that nanoparticles are useless for this purpose. There's thousands and thousands of papers, but the translation to the clinic is practically zero. And the reason's really simple. You can't make them. People will start with a thimbleful, and after years, they'll work up to a bucketful, but they never make them by the barrelful. So if they are used for cancer, they're used for those rare cancers that have no other intervention possible, really high price points. What would it look like if we could change that up and make nanoparticles in such a way that they're good for everybody? So today, as you made your way here today and got out of bed, you were touched by an old technology many, many times. Every bit of water that you drank, if you used a plastic bag, if you drank from a plastic bottle, if you ate spaghetti, if you, ran on a car that has tires, you use something that was made with twin screw extrusion. So twin screw extrusion makes tons of stuff. What would it look like if you could take twin screw extruder and make nanoparticles? That's kind of an absurd thought. And people will tell you that that's impossible. But we do that. And the way we learned how to do this is we bought ourselves a twin screw extruder using a loan that we got from the IRB in northern Minnesota. And we learned how to encapsulate drugs, not by encapsulating drugs. We learned how to do this by encapsulating cosmeceuticals. So there's a lot of cosmeceutical ingredients that are effective for nutrients and for skin health that are equivalent to those anti-cancer drugs. They're large molecules, they have poor bioavailability, but there's a benefit for us in developing this technology. The first thing is we can experiment with things that are cheap and they're not toxic. Another benefit is that we can sample through very many different APIs. And so we have cosmeceutical compounds that have a pretty good match to the compounds that we want to serve up for oncology. And there's another benefit, and that is that when we make these nanoparticle compositions with cosmeceuticals, we can sell them. And we can make them in a lot of different flavors. So what you're looking at here is a table full of a day's product. And you see, they look like sausages. They're polyethylene tubes that are filled with extruded nanoparticles. And the different colors are different flavors. Coenzyme Q10, ascorbyl palmitate, betulin. That just goes right on down the list. So what we're selling today, you can buy it on the website. This is for the people that say that you can't make nanoparticles with a twin screw extruder. You can buy it on our website. But we need to take it to the next level. Well, I just came from a meeting with the NIH where we're working with them to do this, which is to take that bioavailability of a compound that they made, that's brick dust without the nanos, and boost the exposure, and boost, this is an oral AUC curve. That's what we're doing. We have a grant from the NSF SBIR that's going to allow us to make these nanoparticles with the different anti-cancer, and it's for MS, it's for ALS, it's for diabetes. This is applicability across the full spectrum of therapeutics.
Yeah,
We have a grant
Eric,
that,
probably should end there. It's been
Okay.
over 4 minutes.
okay, I'm going to just say, we have a grant that allows us to make these products and put them in the hands of drug companies and universities for preclinical testing. So what am I here for today? I'm here to get help. This is very new. It's very embryonic. We've done a lot of work to show no ifs, ands, or buts, we can do it. We need help to make this therapy available to people. And we're really just starting. Thank you.